Restaurant Unstoppable, episode 731 with Dr. Kara Farley. With excitement, allow me to introduce to you today's guest, Dr. Kara Farley. Are you feeling unstoppable today?
Absolutely, Eric.
Yes, that is what we like to hear. So, Doctor, I don't know why I keep on saying doctor, like I must be from Massachusetts or something. Dr. Kara Farley is a veteran, wife, mother of two, and physician. The COVID-19 pandemic occurred on Dr. Farley's last tour as a Naval Flight Surgeon. During that time, Dr. Farley was a lead member of the Public Health Emergency Services team, where she created and implemented the protocol aimed at decreasing transmission between sailors and soldiers during her during her transition out of the military. Did you retire, by the way? Are you done with the military?
I'm done. Yeah, as of July 1st.
Congratulations.
Thank
you. During her transition out of the military, she realized that the civilian sector was in need of these same services that she had created for the military. And in June, she started Blue Ocean, which aims to give your business the tools for success during the COVID-19 pandemic and beyond. And today we're basically just here to talk about COVID-19, combination of best practices, your responsibilities, your liabilities, the things how you should be handling COVID-19 within your restaurant. If your guest has it, if your employee has it, and just maybe kind of debunking some myths and just talking about COVID-19 in general. Who knows what we're going to talk about as far as that goes, but let's get that motivational, inspirational ball rolling with a success quote or mantra. What do you got for us?
Okay. So Blue Ocean Health Services provides public health service for the community. So that's the goal of my company.
I love it. And you know, it's a great service. I mean, I feel like your retirement couldn't have come at a better time. I mean, with what you were doing and what's going on in the world right now, it kind of lined up pretty well. So, where does it make sense to start talking today? So what do you think is the most important thing we address? Let's just start with who you are. I told the listeners a little bit about who you are, but why don't you really help us round off who we're talking to and why we should be listening to you?
Okay. Absolutely. So I am a primary care physician, and I've only practiced in the military. So been a military flight surgeon for the past 5 years. And it sounds a lot cooler than it actually is. But basically I was primary care and I did an aviation medicine fellowship. So I took care of pilots, air crew, all of those types of people were my patients in the military. So that's my background traditionally. And then obviously in March, everyone kind of experienced a change in all the fields that we were working in. And that was no different for me. So our clinic went to a lot of telemedicine work, and then we went to a lot of protocols for the base because the base had to remain open, right? You know, military members don't stop going to work, still have to maintain your mission. So we came up with plans and protocols to allow them to do that safely. And we used testing in a manner that was helpful to maintain that goal. So as I was doing that, I was nearing my end of my service commitment time. And my husband owns a financial company in Dallas, and he was faced with these same issues. How do I keep my employees at work? How do I keep them safe? What do I do if I have a positive employee? How am I supposed to notify people? When do I need testing? Do I need to test everybody every day? So all those same questions that all businesses are dealing with right now. So I came into his office. I did a lot of teaching for his employees. And then I still do contact tracing for them if they have positive cases, telemedicine visits, all of that stuff. So about halfway through the month of May, he came home one day and said, gosh, you've just been such a huge help. My employees feel so much better at work. We feel like we are really doing the right things in our office. And he's like, I think you should do this for other people.
Smart.
You know, he was like, it's a great service. And that's honestly what I'm all about. Obviously, my father-in-law's got the American flag in the background.
You know, speaking of service, I was kicking myself earlier. I said, I congratulated you on, moving on from the military into the public sector, but thank you for your service and I should have started with saying that. So thank you very much. It's only natural that you continue to serve. So Now that we kind of have an idea of who we're talking to, I'm actually kind of curious. You were the lead on creating these protocols, right? Like, how did you, as a flight surgeon, how did you find yourself taking on the lead for developing these protocols?
So, I mean, really, so, if you're not familiar with the way the military works, we call it voluntold. So don't really volunteer for
Yeah.
anything. It's like, hey, you're doing this job. So that's just the way the order fell in line on base. On our base, we only had 2 physicians at our clinic, and I was one of them.
Okay.
So it was just kind of, hey, you're here, you got to do this, figure it out.
Got you. So what were you kind of reflecting back at that time, and without getting into too much detail, what were some of the biggest things you figured out early on? And we can kind of break it down as we talk about more stuff.
Yeah, I mean, I think the importance of one, restructuring like the way people flow through a building was important. Being able to do the social distancing was important. When masks come into play, hand washing techniques, all of those things. I think hand washing was huge. And then really the number one thing, and I'm sure we're going to continue to touch on this, is screening your people and not having them come to work sick. And it seems like an easy concept, right? Just like, hey, you're sick, stay home. But when you pair that with the fact that our country has largely been shut down for the past 2 months, and all these businesses are suffering, and people want to be at work, and they need to be at work because they need to make money, that kind of places confounding factors on that simple thing that should make it pretty easy to contain COVID and not spread it within the workplaces. People want to be at work. And then the employer also needs their people to be at work. So I think that's where the complexity comes in. And that was what was really important in the military. Like, hey, I know you're a pilot. You were supposed to fly this plane today, but you don't feel good, so we can't put you in that plane, and we have to figure out other things to make that happen.
Yeah, for sure. So when you decided that you could leverage all these recent skills you developed on your exit out of the military, I mean, where were you, like, what was the plan to, like, where were you going to implement this new knowledge and these skills? Like, how was your approach? Are you focusing on the restaurant industry, or are you just on general all businesses right now?
In general, all businesses. I think restaurants face a unique challenge because of all the customers that come in. And that places, just a higher risk for the employees and those interactions that they have. But I do other businesses. I'd really like to help some school districts. So I have some meetings coming up for schools. Nice. I think, again, schools are in a unique situation as well. And it's absolutely a necessary service for our community so our kids can have an education.
Yeah, cool. I think we got a good sense of who you are and what you got going on. I think we should just dive into the nitty-gritty. So the first solid question I have for you is, what are the restaurant owner's actual liabilities? Like, what are they actually responsible for?
Right. So that is a question. I will give a little disclaimer here that you should individually speak to your attorney about because I am not an attorney in any way, shape, or form. But if you look at what the EEOC has put out, it's basically best practices, right? So screening your employees, and we can talk about the different ways that you can possibly do that. Making an environment where your employees feel safe to say, hey, I don't feel good, I can't come to work, and having those practices in place to be able to do that. So it's really all best practices. And then the cleaning, I think, is important. I think something that comes up and came up in our talk last week was the need to report to the public. So that's something I would recommend you speak to your attorney, but that is not legally required. You don't legally have to say, hey, our restaurant had somebody with COVID in it. And we're closing for 2 days. That's honestly up to you. I think really what you're responsible for is that contact tracing and notifying those people who were in close contact with that person. Yeah. Now, if you don't have the ability to do that, then absolutely just kind of a blanket statement of, hey, if you were in our restaurant, there was someone with COVID, may be the right way to go.
Repeat that whole thought real quick.
About contact tracing?
Yeah, that last part there.
Okay. Yeah. So a lot of restaurants are, and I'm sure we've all seen this in the media, they come out and say, Chick-fil-A, for example, would come out and say, hey, we had an employee that tested positive, and they just make that statement to the public on this day. So anyone who's been here may be at risk. The better thing to do, and the thing that the EEOC and the CDC and everybody keeps saying, is contact tracing. And what that means is, so let's say I'm the employee who has COVID. So that employer would come to me, Kara, and say, hey, you're the one who had COVID. Who are the people that you came into close contact with? And the definition of contact tracing is within 6 feet for over 15 minutes. So those are the specific people that need to be notified that they have come into close contact with someone who is positive for COVID.
So that was within 6 feet for 15 minutes. If you those are the guidelines for whether or not you need to start reporting this sort of thing.
Right. And yeah, so let's say if it was me and you, Eric, right, to keep it simple. So I'm the person who has COVID. Let's say we were doing this in-person interview, right? It's going to go for over 15 minutes. And we were within 6 feet of each other. So if tomorrow I get sick and I get a rapid test and test positive for COVID, then I should tell you, but let's say our employer was involved, right? They would come to Eric and say, hey, you've been in contact with someone, close contact. The contact tracing was positive with someone who has COVID. Now, he doesn't have to release my name. In fact, he can't because that's against HIPAA. So it's the same way kind of the reporting works for other diseases in the public health system. They would call the person and say, hey, you've been exposed to someone with, XYZ disease.
Okay. So to make sure I understand, the only time you have to, when you should reach out to people is if they were in contact within 6 feet for 15 minutes with that person. Otherwise, they don't need to be contacted to let them know that they could be exposed.
Correct.
Cool. And I should give a shout out to David Denny. You mentioned lawyers earlier, and you mentioned our chat last week or earlier in the week. The reason why Kara is here is because of that webinar that I sat through that David Denny, past guest in the show, hosted. So thank you very much, David. A little nod, tip of the hat to David for putting you on my radar, and happy you're here. So we kind of talked about liabilities. It kind of sounds like there really is no liability, but it's more of like an ethical thing that we need to be like, these are the best practices. Like, we have a responsibility, a civic responsibility to communicate.
Agree. I think, there have been cases in the media of people getting sued. I don't know if any of those have actually held any value, but I would say if you, as a restaurant owner, as an employer, are doing these best practices, the best that you can, then that's all we really can do. You can't mitigate all risk. There is an inherent risk for COVID every time you leave your house.
So, I mean, I guess you're kind of answering the next question is like, so aside from liability, what is our social responsibility? And I kind of feel like what you just gave us is that social responsibility to be tracing and to be keeping track of who's where. But as far as like other best practices, what are some of the other things we need to know as far as communicating to our employees and the protocol? If this, then what? Like, what are some of those things?
Okay. There are several. So we can start with, I think, the most important and basic one of washing your hands and washing your hands correctly. So there was a study maybe 20 plus years ago that they did in the military with recruits in basic training and hand washing. And they were all having a bunch of like the cold outbreak, right? Everybody was getting the cold, and then they'd have to stay in the barracks for a couple of days. So they were losing a bunch of training time. So they said, all right, everybody's got to wash their hands 10 times a day. And when they implemented the hand washing process for the recruits, and this is no social distancing or anything like that, just hand washing, they decreased the cases by like 50%.
Wow.
Yeah. So hand washing is great. It's really important, especially for what we know about COVID, which is that it is passed through droplets and through contact. So if you're washing your hands before you touch your face, you're going to decrease a lot of that risk. So that's important that your employees know about that and know how to wash their hands, right? Because just running them underwater,
right,
the little bit of splashes isn't going to work.
It feels silly, but like, really explain, how do you wash your hands? Like, what is the standard for washing your hands? I know we have placards all over restaurants, but just say it.
Right, exactly. So it's supposed to be for 20 seconds at least or more. And you're supposed to get actual sudsy soap on all parts of your hands. Really think about cleaning under your fingernails as well, in between all of your fingers. And then you are supposed to go up your wrist a little bit. So that whole process should take 20 seconds at least, and then rinse the water off. And I know we touched on this before, but COVID is surrounded in a lipid envelope, the actual virus, which is fat. So soap, if you think about pouring soap on a greasy dish in the sink, it breaks apart fat. So the soap itself is all you really need. So, and then that brings into play, when do you wash your hands versus use hand sanitizer? So in the medical community, anytime that your hands are visibly soiled, you should be using soap.
Okay.
Okay. If there's not visible soiling on your hands, hand sanitizer is fine.
Okay. So I mentioned earlier, I might be getting ahead of myself a little bit with some of like the myths that might be out there, but didn't the CDC mention earlier that they believe that this thing, COVID-19, isn't really being transferred through, like if I have it on my hand and I touch a railing, and then 5 minutes goes by and somebody else touches that railing, they're saying that it's not being transmitted through touch and contact. Is that true or false?
I think that the verdict is still out a little bit on that. There's mixed information. I would say that it's possible, but definitely less likely. So there is evidence to both sides, I guess. I would say that it is less likely for you to get it, like let's say a railing or a piece of mail or something like that, much less likely, because every second that the virus spends on an inanimate object, it's going to degrade. Right. Okay. So if you remember that study coming out, it lasts X long on these materials, and one little tiny COVID virus that you touch to your face and put in your mouth or your nose or your eye, you're not necessarily going to get COVID just from that one tiny virus. You actually have to have a decent amount of the virus particle for you to get it.
Is there a specific amount? Not that we would be able to count it as it's going into our body, but like.
Right. And that's why people who are less symptomatic and people who maybe you've been exposed to before they started showing symptoms, you're less likely to get it from them because their viral load at that time is lower. So the chance of the virus being in their sneeze that touches you is less, if that kind of makes sense. So I think we're getting a little off track
we have. Here. So to bring you back on, I put you there, so it's my fault. So to get back on track, we talked about screening. Our responsibility as restaurant owners is first and foremost screening. You didn't mention your app really in that. Did you want to bring that back? You want to mention that now?
Yeah. So let's go ahead and talk about screening and different ways that you can screen your employees and when and where you want them to be screened. Okay. So screening should definitely be done for all of your employees, ideally before they come to work, because once they come into work with symptoms and positive, then that's where the whole contact tracing and exposure and people needing to quarantine and self-isolate comes in. So ideally they're doing it before they come to work. And so my company did develop an app. It's very simple. It's just got those questions that you've seen everywhere. Have you been in contact with anyone for COVID? Has your doctor told you that you need to be self-isolating for COVID exposure? And then it's got the list of symptoms. So if any of those are positive, they should be speaking with their manager, speaking with a physician before they come to work. Another way you can screen is with temperature checks. So there's been a lot of different organizations, governing organizations that have said, yes, I think massage parlors are one of them that say that you have to use a thermometer for screening or temperature checks for screening. Temperature checks are good. I think that there are a lot of issues in particular with using that.
Like what?
One is that the person's already there, for one.
Yeah, so they came to work, so they're already infecting you.
Right. Yeah. So they're already there. And then two, you've got, who are you deciding to take the temperature check? Unless you're a hospital or a clinic, perfect, great. I'll put my medical assistant or nurse out there. No issues, because she does that on a daily basis anyways. She has all the trainings. She has all, she already knows her risk and everything for that. But if you're a restaurant, you're putting one of your guys out there. So now that person's being in contact with every single person who comes through the building. So there's another issue. So I would say if you are doing temperature checks, let people check their own temperatures. Just hold it up to their forehead, write it down on the piece of paper. And then the third issue with that is that not everybody is having a temperature, especially in the beginning phases, if they even spike one at all. The people who are getting really sick and who are having the severe complications and who are in the hospital, they are absolutely having fever. But now those, in the beginning of COVID, a lot of the people who were getting sick were older. And I think the reason is we were seeing a lot of infections in nursing homes and hospitals and those kind of things. Whereas now we're seeing more infections in the younger population. And a lot of those younger people aren't spiking a fever. They have fatigue, they have a cough, they've got a runny nose, a headache. That's it. So I think the temperature checks are missing a lot of that. It's one symptom on the list of 15, for COVID.
So I guess what I'm hearing is like I heard, and I'm kind of getting ahead of ourselves, but I heard that from the previous webinar that I sat in on, is that it takes approximately 5 days, right? 5 days from when you contract it to the symptoms to start showing. What is that period again?
So it can be from 24 to 14 days.
Okay.
So if you've been exposed, let's say today, I exposed you today, your time for contracting the virus or starting to show symptoms would be 14 days. But 95% of people show symptoms within 5.
Okay.
So most people are going to show symptoms pretty early on, but there have been cases of people showing symptoms as far as 14 days from exposure.
Yeah, and they might not even get a temperature. So the thing is, like, they could just be like, oh, like I didn't get enough sleep last night and I'm not sick. I'm just tired. Come to work, get their temperature taken, be 99 degrees, and they're under the radar, giving everybody COVID-19.
Exactly. And like I said, especially in the younger population that is at lower risk for developing more symptoms and more complications, it's going to be even more likely in that population. And, in restaurants, that's most of the people who work in restaurants are usually younger.
Yeah. So, okay, back to the top of the conversation, screening. So before going to work, do you feel sick is what you should be doing. People are doing temperature checks. What else in regards to screening?
So I think those are pretty much the main two for screening before you come into work with the symptoms, and then potentially the temperature checks at the door. And then also just having your employees really aware of their health and what's going on with them, and reminding them, hey, because you can still develop symptoms while you're at work, right? So if for some reason halfway through your shift, you just start not feeling that well, you start getting chills, you start feeling feverish, just be open and tell someone. And I think that's huge for employers to be able to create that atmosphere for their employees so they feel safe to be able to do that.
I'm going to put creating a culture of communication and awareness, self-awareness. So what is your advice for how that conversation should look? Like if we're listening to this right now and like, I really haven't had this conversation, I'm sure people have talked about it, but what should that conversation look like? How should we approach it?
With your employees?
Yeah.
Yeah, absolutely. So I would say, at each different shift, if you want to meet with them, with all your employees, or if you want to do a Zoom call, send out an email. But I think employers should say, hey, look, I know we're in uncertain times right now. COVID is out there. We're reopened. I want you to feel comfortable coming to me and telling me, hey, I don't feel well. I need to go see a doctor before I can come back to work. And I think I've had some employers too concerned about employees maybe taking advantage of this situation. So to the employers, that's where I would say is really, I know it seems childish, like we used to have to do it in elementary school, but they need to have doctor's notes, so you can't just say, oh, I don't feel well, I'm going to stay home today and then I'm back tomorrow and I didn't see a doctor. So you need to have a telemedicine visit or a test or something saying, hey, they're cleared to come back to work. And that's whether or not they have COVID.
Okay, we're back, and what we just were talking about was this idea of how to communicate with our employees. You were saying a lot of people are taking advantage of this, and that there should really be some type of like doctor's note or some way of proving that they are in fact not infected with COVID-19. That includes testing, I'm assuming. So what is the protocol for like, okay, I think I might have COVID. What should we be telling our employees if they think they have COVID? Like, where do they go? Like, is it straight to the hospital, urgent care? Is there a self-home test?
Yeah, there's all of the above.
Okay.
I would say I would not recommend going to a hospital. So like a big hospital, unless they have severe complications. So difficulty breathing, super high fever that's not coming down with over-the-counter medications. Those are reasons to go to the hospital. Chest pain, any of those things, and we focus on COVID, but of course, everything else that typically happens in the medical community is still occurring as well. So any of those severe symptoms where you feel like, I can't breathe, my chest hurts, any of those things, you need to go to an actual ER. But if you just have mild symptoms and a sore throat and, maybe 100.6 fever, then I think contacting your primary care physician would be great if you have one, because a lot of these urgent cares, drive-through centers, they are back up, especially in DFW. So that's where I'm based out of. So the test I'm seeing now, like 3 or 4 days to make an appointment for a drive-through test is how far they're backed out. So so I would say your primary care physician if you have one. If not, then absolutely one of these drive-through places. Most places do a drive-through if you're symptomatic, and you can come in if you're asymptomatic, meaning like I just want to test. Yeah, I want to test because my boyfriend has COVID. So I've been exposed and I want to get a test. So maybe I have an asymptomatic case. So those people who are asymptomatic can usually go into the office and get a test, but everybody else is a drive-through as long as they don't have severe symptoms. And then there are 2 different types, right? There's the rapid antigen test, and then there's the PCR swab. They're both PCRs, but a PCR swab that you would then send out to a lab. So the rapid one is available. It's becoming more and more largely available. I actually have an analyzer on order when I'll get it, but everybody wants them, but a lot of places will only accept insurance. And if you don't have insurance, it's like $500. And then other places only accept cash pay, no insurance, and they're like $200.
Jesus.
Yeah. So that could be really expensive. And then the other.
Are these 2 tests equally effective or accurate?
Correct.
Okay.
Yep, they're exactly the same.
And this is the test to see if you are or contagious, like you have it active in your system.
Correct. Okay. So the test for actual COVID. And then, the PCR is a swab that you send into the lab, and that one, depending on the area you're in, can take 2 to 10 daes to come back.
And there are other tests to test for antibodies. Is it even worth getting those tests? Because we haven't proven, I guess this is kind of getting ahead too, is herd immunity even like in the play anymore? Is that even like a possibility, or have they ruled that out?
Yeah, so we can talk a little bit about that.
Wait, let's put that on the back burner. Let's put that on the back burner because I feel like we'll get way down into a rabbit hole. We're definitely going to talk about that. But so just to kind of go back to the surface real quick, we're talking about screening right now. The ways to do that are by first just like paying attention to how you feel before you go to work. How do I feel? Second thing, temperatures, creating culture of communication. We're like in literally having the conversation and reminding your people daily, how do you feel before you come to work? How do you feel? Do a self-assessment, like, and be mindful of how you feel. Hand washing is another thing we discussed. Anything else we haven't talked about as far as like masks? I'm sure is another huge conversation.
Masks. I think masks and cleaning are the next 2, right? So masks, obviously in some areas there are mask mandates. Masks are useful when you cannot maintain that social distance. Okay. I mean, like if you're outside in the mountains, in Montana hiking, you probably don't need a mask. But if you're within a closed area for people for a prolonged period of time, masks can be very useful. So if you cough or sneeze, it'll keep that in instead of allowing it to spread. So that would be a good time when masks are useful. And like I said, in some areas, masks are mandated. Now there are different types of masks, right? We've got the hospital grade masks, like the N95s. People in general do not need to wear an N95. So an N95 is actually fitted to your face, and you have to do a little procedure in order to know if you have a correct fit. So people just going out and buying an N95 mask without the fitting is probably not very useful because it's supposed to actually make a complete seal. So they put you in this hood and they squirt this sugar water in there, and then you have to read all these sentences off and see if you can taste the sugar water to know if the mask is actually effective. So N95, not for the general public, because you may not even be wearing it correctly, so it's not being used to its full potential. And then we've got like those surgical masks, so the 3-ply surgical masks. Those are actually the best. The disposable ones, I know.
What do they call specifically? What's the name of that mask?
So they're surgical masks.
Okay.
So those disposable 3-layer surgical masks are going to be the best. And I'm a big proponent of recycling and all that kind of stuff, but I feel like in this case, I would recommend the disposable over the homemade cloth ones, just because you can take them off and throw them away. And
you're seeing a lot of people wearing, like the majority of people are wearing those
are the cloth masks. Yeah. I mean, they're better than nothing. I'll say that. They're probably not the best option. I would say the surgical ones are, but they're better than nothing. And the other thing about masks is if everyone in the room isn't wearing one, they're kind of ineffective. So I think that's a big push with these mask mandates in areas, is because the masks are going to protect me from you, but not necessarily you from me. That makes sense. But if everybody's wearing them, then we're all protecting each other. And they're not 100%. Even the N95s in the hospital, when we're wearing them as physicians and intubating people, they're not 100%.
So you've dropped two specific types of masks right now. The N95, which is like not really worth it because you're probably not going to do it right. The second one is a disposable 3-ply hospital mask. Any other types of masks that you'd recommend that are like worth sharing?
I mean, yeah. I mean, the cloth, I would say the cloth mask, you know.
Is there a cloth mask on the market that's the best in your opinion?
I'm not familiar with all the specific ones. There are so many.
Okay.
I would recommend one that probably has multiple layers, you know, just not a single one. And then the important thing about the mask, if you are wearing it, is that you're wearing it correctly. So please don't let your nose stick out of it. Because if you sneeze, then it's pointless.
What about my beard? Should I shave it down further? Is it too long? Is it even worse?
I think it looks great on you, but yeah, that may be an area where you can hold bacteria.
Right.
But I'm a beard, so you know.
So okay. Anything else regarding like best practices? What about those masks, those shields that you see everybody wearing?
Face shields. Yeah. Great point. So face shields are going to protect your eyes, right? Because the virus gets in through mucous membranes. It doesn't absorb through your skin. So you have to actually put the virus into your mouth, nose, or eyes somehow. So the face shields are going to protect your eyes. So in the medical community, as a physician or a medical assistant, if I go into the room with a patient, so let's say my patient was you, Eric, the Texas Medical Association is requiring that patients wear masks and doctors wear masks, at least. But if you have a mask on and I have a mask on and I have a face shield on and you have COVID, let's say, your test came back positive, my risk of getting it through that really close patient interaction, maybe an exam where I was listening to your heart and lungs, looking in your ears, all that kind of stuff, is really, really low enough to where I wouldn't have to go home and quarantine.
Okay.
So that's an important protection feature, I think, for the healthcare community, just so that we can actually stay at work and continue to treat patients.
Yeah.
But that's also something to consider for people who are either at higher risk in the public to protect themselves more because they are protecting their eyes then and their whole face, or in a scenario where they are coming in closer contact with people. So we talked a little bit about bartenders in that scenario, and if that would be useful for them because they're pretty close. You know, it's easier for a waiter or waitress to keep that 6 feet back from the table and, you know, just kind of set the plates down and walk away. They're not within that close distance, but a bar. So yeah, we had talked about potentially face shields being useful for bartenders.
So I think after talking about masks, we kind of covered all the major things, right? Cleaning. Sorry, get into it.
Yeah, just cleaning, and we'll just basics on that. I think there's a lot of different stuff out there right now, right? Use a CDC approved cleaning material, or you can go on the website. There's a huge long list of them on what works against COVID. So use something that's on there. And my recommendation is to increase the frequency by which you clean and disinfect. So cleaning and disinfecting are two different things. But they both should be happening on a more frequent basis than they were before. You don't have to necessarily do that crazy, like close down your store for 4 days and
scrub
do the
ceiling.
super.
Yeah.
Right. But if you're cleaning and disinfecting on a more regular basis, then you don't have to worry as much because, somebody came in with COVID, which is going to happen more and more frequently as there are more cases. That's okay because we clean and disinfect every day after every shift. So we're good.
Which was happening like before COVID-19, which is really frustrating because people are like, I don't know, not worth getting into. But on that note of cleaning, are there any chemicals you recommend as far as like affordability, like, you know, for the best bang for your buck? Because we're going to be cleaning so often. Like what are the ones we should be going with?
I honestly don't even know.
Yeah.
I haven't priced them out.
Yeah.
But I would recommend going on that CDC
Gotcha.
website. There's literally like over 100
Okay.
that
And
are listed on there.
I picked up from the webinar that I sat through, David Denny's webinar, that there's services out there right now that come in kind of do like bombing, where they just come in and like bomb the space. Is that necessary? I can't tell if you're pausing or if the screen
Maybe
froze.
in a particular case, but I would say in a general sense. Okay. I would say in a general sense, probably no. There may be a
Okay.
particular scenario where that is necessary if you've got multiple people with COVID in your office and they're
You're
all
just trying to make a
spreading.
point.
You what?
You're just trying to make a point. Like, it's safe, right? Like you're taking all the precautions. I think that's one of my biggest fears. I'll save that. I'm just gonna put down biggest fears down here so I don't forget. Biggest fears. So okay, I think we covered A through Z. The one question I still kind of have lingering regarding screening, if we don't have your app, right? If we're not getting people to check in with the app at home and communicating with the app, what is like the step by step like actual screening procedure as far as like the record keeping? Like, do you keep a sheet? Are people signing in? Like, what does that look like? We didn't really get into the details of that.
Yeah, so I would recommend that absolutely you keep a record of it as an employer, because that's going to prove that you've done your best practices, right? You keep a record of people cleaning the bathroom.
Yep.
You know, you've got a little sign-in sheet, so you need to keep a record of this.
So what's that sign-in sheet look like? Like what should be included in that sign-in sheet?
Yeah, so are you talking about specifically what should be asked?
Yeah, like what does the sheet look like? You know, name,
Okay.
number, like is it just
for people when you're screening them. So for your employees, so the app that I developed makes it very easy, right? Because in that case, so the employer and the employee have different versions. The employer gets a record every day of all their employees and their screening and whether they passed or failed.
Okay.
So if you were not using the app, I would say, so what I have for my companies, if they don't have the app or before my app was finished, is a laminated piece of paper that's posted all over the office that was also emailed to all the employees, and it has the questions at the top about your COVID exposure. So you cannot, as an employer, ask your employee if their relative or wife or husband or girlfriend, boyfriend has COVID. You can ask them if they've been exposed or in close contact with someone who has COVID. So that's a question on there. And then a second question is, have you been told by a physician that you should self-quarantine due to exposure of COVID? So those are questions that need to be asked. And then we have the symptoms, right? So fever, fatigue, and fever is defined as 100.4 or higher. Okay, so just so we clarify that. So fever, fatigue, chills, shortness of breath, cough, runny nose and congestion were just added. Diarrhea, nausea, vomiting. I think I might, sore throat, and headache are all on there right now. So those are the things that people need to be looking for. And the other caveat is some people have chronic migraines, some people have asthma. So I think another important thing, and that's also on my app, is that these are new conditions that are not related to a currently diagnosed medical condition.
Got you. So the other thing we haven't really talked about is we've been talking a lot about how we're screening our employees, our relationship with our employees, how we're communicating with our employees, the best practices as far as PPE and just behavioral practices to stay safe. What about screening guests? Because I've been to a few restaurants and there are people that are recommending that when people come to your restaurant, they should be signing in with their contact information so we can reach out to them if there is an outbreak. Is there any best practices around that?
Yeah, I think that's a great idea. Okay. Especially for restaurants, since they have so many people coming in and out. And if as a restaurant, you don't want to say, hey, we had somebody, an employee with COVID, and just kind of blanketly put it out in the media. And you want to actually notify those individual people who potentially were exposed, which is the best way to do it, right? Because then as a guest of the restaurant, I'm like, oh yeah, I was there, but whatever. And I don't do anything. And then I show up with COVID, and how many people have I infected? Versus getting a phone call saying, hey, the waiter that you had tested positive for COVID. So you were
tested or something. Yeah.
Exactly. Yeah. So I think having people
sign in, they don't have to get tested because it's less than 15 minutes at a time. Like the server would
Right.
be approaching your table for like
So
30 seconds and then leaving.
correct. So it would have to be a positive contact trace. So those would be the people who would need to be notified. So I would say absolutely. You, even if it's just a piece of paper, date at the top, have the people put their name and their phone number or name and email, whichever you prefer. And then maybe the time frame that they were there, have them check in and check out. And the other thing you could put with that, so one, that gives you their information for contact tracing, but two, you have that form that I just talked about laminated and sitting up in front of it. And the hostess at the front says, hey, do you have any of these symptoms? If no, put your name and phone number here. And if you do, we'd appreciate it if you didn't come into our restaurant. So I think that's a way for you to screen your customers. Ideally, people aren't going out if they're sick, but
yeah,
we can get into that later.
Yeah. Okay. So, does your app handle both sides of that, the employee side and the guest side, or is it just the employee side?
It is just going to be for employees.
Okay. And if we are interested in leveraging your app, where can we go to find that? Just real quick.
So you can contact me. So you can go on my website. It's blueoceanhealthservices.com. Or you can shoot me an email. It's Dr. Farley, like DrFarley at blueoceanhealthservices.com.
And this is episode 731. So if you guys go to restaurantunstoppable.com/731, I'll link to the website and your contact information over there for you. It's easier to remember that number, I suppose. All right, we're back, and now I'm just gonna throw you through the ringer now and just ask you a bunch of questions just to have fun / feed my own curiosity. So, you mentioned earlier that you should not be broadcasting to the media or over media if somebody tested positive. Why?
Well, not necessarily that you shouldn't, but there are better things that you could do.
Just as effective and less detrimental on your business, basically.
Yeah. I would say more effective, less detrimental on your business, and better for your customers. Mm-hmm. And the caveat to this is that you have the ability to do this. And that's the contact tracing, right? The contact tracing is extremely important. So, because let's say that dishwasher in the back of your office took a smoke break with, a guy from the front. So like a hostess. And that person, they took a 20-minute smoke break. They were out in the back and the dishwasher was positive for COVID. The hostess should be the one who should be notified, because if you just come out and say, oh, well, somebody in our restaurant had COVID, she has no idea that she was personally exposed. Now, she doesn't have to know that it was the dishwasher who exposed her, but she does need to know that, hey, you specifically were the person who was in close contact with them, because if that is a positive contact trace, she needs to self-isolate for those 14 days to see if she starts showing symptoms, or she can talk to her physician about getting a test.
Got you. And these tests are the tests. We covered the at-home test, right? Those are the ones that are $300 to $200, or no?
Oh, no, we didn't talk about the at-home test either. So I mean, gosh, there's so many different things to test. So yes, you can also do an at-home Pcr swab. So I was actually on one of their websites today. I think there's a couple other companies, but you request a packet, they send it to you. You take the self swab, it overnights, and then ideally it takes 1 to 2 days for your test results to pop up on your computer screen.
Okay.
So that's absolutely a way for you to do it. You don't need a physician note.
Do you need to give your name? I mean, they have to mail it to you, so they're going to know who it is.
Right. And so the CDC is tracking all that in the positive cases. That's how we know how many people are positive. It does have to be reported to the health department. And the idea is, so contact tracing is not a new idea, right? It's been around forever. We have contact tracers who notify people for HIV exposure, chlamydia, all of those kind of things, other communicable diseases. But in this case, we are hundreds of thousands of contact tracers short. So that's why they've been saying, hey, people need to be doing it in their place of employment, so that they can notify these people. And then, because let's say we didn't tell Ashley. So we didn't contact trace. We never talked to our dishwasher. We never told Ashley that she was exposed. So Ashley continues to come to work. She has no idea. And then day 6, day 5, she's kind of feeling fatigued. Day 6, she's at work and she's like, gosh, you know what? She goes to her manager and says, I really don't feel that well. I think I have a fever. I'm going to go home and go to the doctor tomorrow morning. I called my doctor. I got an appointment in the morning. Okay. So now Ashley has exposed how many people who
Right.
have come into the
For how
restaurant,
many
right?
days? Yeah.
For how many days? Um, the contact tracing starts 48 hours prior to symptom exposure. Okay, so for the past 3 or 4 days, she's been exposing people within the restaurant, and now she's going to her doctor's office and exposing her doctor without knowing that she's been in contact with someone with COVID. And maybe that weekend she decided to go visit her grandma, thinking, "Oh, I'm doing good. I've been practicing social distance." So you see where the trickle effect occurs there.
Yeah.
So that's the really key importance of that contact tracing and notifying those people.
Got you. Have we spoken about what happens if a guest tests positive for whatever reason? Are they, and they like reach out to you and say, "Hey, I tested positive." What do we do in that scenario?
Okay, so ideally you've taken a log, right? Or that person tells you, "Yep, I was at your restaurant." Let's say they call you and tell you, "I was at your restaurant 3 days ago and my symptoms started today." Well, I don't have to worry then, right? Because we're not within that window. Or they call you and tell you, "Hey, sorry, I was there, but I was actually feeling bad yesterday." So then those would
Knucklehead.
be yeah, exactly.
Yeah.
Those would be the questions for that person. Who was your waiter or waitress? What table were you sitting at? So then you can go back and look, was there anyone that you were actually, was there someone that you actually exposed? So that would be the way I would go about it.
Got you. So now it's kind of like more like the hypothetical things I've been hearing out there, and like, okay, so one thing I've heard a bunch is that the amount of people who have been reported as being positive for COVID-19, that actual number is a really like horrible representation of the actual amount of people who have COVID-19.
Correct.
What, how bad is the representation?
Probably 10 times more than what's being reported.
Okay. If that's true, then are the numbers for so say for example, does that affect the death rate? Are they taking these things into account? If there's 10 times as many people as we think that have it, but everyone who's dying who's testing positive, like there's a ratio there, right? So we think 4 million people have it, and whatever many 400,000 people or whatever, I forget the numbers. It's been a while since I checked.
Right.
So you get a percentage of like about 5%, 3 to 5% of people who get it die, or whatever the number is, the latest number. If it's actually 10 times more than that, wouldn't it be like 0.0005% of people who get it die? Is that crazy by saying this? Because I feel like when I say this, I get a lot of like snarks and like, you are an asshole for even suggesting that. But I'm like, it's math. It's simple math. And like, is it true? Is what I want to know.
I would say that's absolutely correct.
Okay.
Yep. Go ahead.
What does that mean? I don't want to, because I'm neutral. Like I'm here to learn. So what does that mean for us?
So I think to go back and remember, because society as a whole, I think, is confused on this fact, is that why do we close down? Why are we doing all of these things? What is the point of the mask? What is the point of the social distancing? So it is not to stop COVID. There is no way to stop COVID. If we all stayed in our house for 2 weeks and didn't touch anyone except for our own family members, COVID would still happen. Because there's a trickle effect of how people are exposed, right, within a household. You would have to do it for longer than 2 weeks. So the reason for doing all of these things is to decrease the load on and the burden on the hospitals, so that we have enough beds to treat the people who have severe complications. Okay, and we have enough doctors and physicians and nurses to be able to do that. Because what we don't want to happen is like what happened in Italy, for there to be too many people that are sick and not enough doctors and beds to care for them, so that people are dying because they don't get the access to care that they need. So that is the point of all of this stuff.
Okay.
So I think that puts it into perspective in remembering that fact. So the point of all this is to decrease the burden on the hospitals. COVID is still going to be out there. COVID is still going to spread through the community. And everything like that. And yes, I think the mortality rate is absolutely falsely elevated. It's probably much lower than what we're seeing. And there's no way to tell until the pandemic is over. we're not going to be able to have an accurate mortality rate until 2 years from now.
Why will it be over in 2 years? How's that the number? How do we know it's going to be over in 2 years?
Well, I guess we don't really know, but that's the hope, right? And that's the scenario that we think is most likely to occur. So there's a lot of factors that we don't know that go into play of that, and antibodies is one of them. So
that
in
scenario that you just mapped out for us is assuming that herd immunity is a thing. It will take 2 years for it to reach everybody, for it to get, not everybody, but enough people where it can't spread.
Right.
Gotcha.
And if you look back historically on all pandemics, plagues, all those types of things, they don't last forever, right? They eventually run through the course of the population and then they go away.
Yeah.
So most likely that's going to be what happens with COVID. The good thing is that it's 2020 and we're working on vaccines, and there are vaccines that are already in phase 3 trials, which is great.
What does that mean? What, for me, people like me who have no idea what phase 3 trial means?
So phase 3 is towards the end.
Okay. How many phases are there?
I think there's 3 or 4.
Okay.
I am definitely not a vaccine expert by any means, but so they have to make it through all the phases, and then human trials as well, and then they also have to be mass produced. But vaccine would give us a way to create herd immunity, right? That's the way vaccines work, all vaccines. So let's say we vaccinated everybody, like looking at the measles and mumps, and not everybody takes to the vaccine. So you vaccinate everyone to protect those few who don't create antibodies, or those few who, let's say, can't get the vaccine because they have an immune disorder, or they're on chemotherapy, or they're allergic to part of the vaccine. That's the point of everybody getting the vaccine. So the vaccine would be ideal. But if that doesn't happen, I think the other most likely scenario is that COVID will run its course through the population. But Spain actually just did a look at how the percentage of the population that has antibodies, and it's only about 5%. So they're nowhere near being close to herd immunity.
Where's Spain on the spectrum of how well they're handling COVID-19?
So Spain had a pretty bad outbreak towards the beginning. I think that they're doing better now. So I would say they're probably on par with the rest of Europe.
Okay. The general census out there is that America is a bunch of schmucks and we're really screwing this up. Is that true?
I don't think anyone really handled it great. People took different approaches. Sweden just really didn't do much of anything. And
how are they doing, by the way? What's the latest and greatest on that situation?
They're doing about the same as everybody else, which is interesting. Like, is it just gonna run its course no matter really what we do? Or some people are just going to be asymptomatic. Some people are going to have more severe complications. I think a lot of this is we just don't know.
Better question is, how is their economy doing?
A lot better than ours.
All right,
I think that's pretty easy to answer that question. And 3 years from now, we might look back and say this was a terrible mistake to shut down the economy. And we're still seeing the effects from that. Or we might say, hey, it was actually a good thing that we did it. There's no way to know.
In full transparency, the last thing I want to do is get everybody that's listening to the show to be like, this is a bunch of bullshit. Fuck this. Like, let's, pardon my language, but like, why are we even bothering? Like, let's just do what we want. And
right.
And I don't want to encourage people to not play nice. You know what I'm saying? Right. That's the last thing I want to do. But I think it's important to, like, one of our core values, it's right here on the wall next to me, is challenge the status quo. Don't settle for what people tell you. Like, push the envelope. Ask questions. Don't take anything for the face value. Like, pull back layers. Like, that's what the show is all about, is pulling back the layers. So,
yep.
I mean, I think it's important that we tell the truth, right?
Yeah, absolutely. And that's what I do as a physician. I'm not telling people stay inside, let's keep everything closed. I'm a huge proponent of the economy being open and people just taking the precautions that need to be taken. So washing your hands, wearing the mask if you can't maintain a social distance, and the number one thing is staying home if you're sick. Yeah. Absolutely, that's what we need to do as a community in order to move forward, are those things. But I'm also a huge proponent of schools opening. The American Academy of Pediatrics came out and said schools need to open. The detriment that we are causing to our children by keeping schools closed is much worse than COVID.
Yeah.
You know, and
I feel like the same thing could be said about people who've dedicated years of their life, like a majority of their life, to building a business, to getting to a point where they're finally like, okay, like I put the work in, my business is cruising. And then this happens and it's like, everyone's going to start from scratch, you know? And it's like all these years of investment to like build a business overnight, you know, commercial pilots. I'm a commercial pilot. I was a commercial pilot before this. Like all my friends I went through aviation with who are finally making it to United and JetBlue and like all these organizations that they worked their entire career to get to this point. The past 10 years of life, $200,000 worth of an education, they're laid off and furloughed for indefinitely. Who knows what the state of the aviation industry is going to be. You know what I'm saying? Like there's such a big impact from this. It's scary.
it absolutely is. You know, and how long are we going to see these effects for? I agree with you 100%. Another physician I was having a conversation with at the very beginning of COVID, because that kind of has always been my mindset is let's just take the precautions. Let's stay home if you're sick and let's do these best practices and let's move forward with our economy. As long as we are able to keep the hospitals down to a point where they're not being overloaded, right? That still is the number one thing. So, but we were having a conversation about this and I was kind of in a similar side to where you feel of, you know, look at what we're going to do to our kids by closing schools, look at what we're doing to our economy by shutting down businesses. And she said, how can you weigh a person's life
I can do it
from COVID?
And I'm probably going to get in trouble for saying this, but I'm sorry. But here's the thing. From what I gathered, the people who are at risk, most at risk, are people who are over the age of 80. The majority, isn't it like 90% of people who are dying from COVID-19 are over the age of 80?
Mm-hmm.
So, and I hate to say it, like all lives were created equal, but not all lives have the same value. Because if you're old, time is money. I'm sorry, you've expensed the majority of your value. And that's not a horrible thing to say. It's realistic. It's reasonable. You know, like these people, to say that it's selfish and greedy to want to have the economy going, I would say it's the opposite. If you want the economy to stop to save grandma, you're selfish. Because you don't want grandma to die or mom and dad to die. And I'm sorry, humans in general are a very greedy species where we want more and more and more. We're living, 10, 15% longer than we used to? At what point is it just we had enough? It's a part of the life cycle. People die. And I'm sorry, if you're one of the people that are just unhealthy, well, I'm sorry, but those were life choices. And if you have if it's some people, there is a percentage of people who are victims to this, like who have autoimmune diseases. And my heart goes out to those people. It really does. I would hate to be one of those people. And I would hate to suggest anything negative, you know, like that's a real concern. And that is where our effort should be going, is how can we give aid to these people to protect these people who are at the highest risk, who are at the highest risk at no other cause, but that's just the way they were born, right? There's no accountability, you know, for the people who are obese or have high blood pressure or any other side effect that came from poor life decisions. And I'm sorry, there's value you can put to that. Maybe I'm an asshole for saying this, but I don't know. This is how I feel.
I think that's a good point. I think it's just very hard for someone to say that. You know, and
I'll bend over and take one for the team. I'll probably get some horrible emails tomorrow, but
yeah, and it's hard for people to back that mentality too.
It's pragmatic.
But yeah, no, I mean, I do agree with you. You know, there is that population that we are concerned about: people who have cancer, the people who have autoimmune disease. And those are the people, you know, and that was kind of my thought from the beginning: is why don't we just have those people quarantine and let's put in procedures and stuff in place for those.
Let's give them billions of dollars to make sure that they can pay their bills and sustain the life they had before all this, right?
Correct.
But it's too late for that at this point, I feel like.
Right.
What is that percentage of people who are actually at risk who are victims? And I'm saying victims as in they're healthy otherwise, but they have a case, a situation that's beyond their control.
Yeah, I don't know the exact percentage. I would say it's probably small.
Like taking before or after the the times X people we didn't take into account. You know what I'm saying? Is it 0.00001%?
Yeah. I honestly don't even know to be able to give you a reliable number, but I'm just thinking in my mind, the percentage of Americans that are obese is 30%. And in relationship to that, it's much, much, much smaller. But I agree with you, but we're kind of too late for that. So I think the best thing in the current, the best thing to do right now is keep the economy open, get the kids back to school, keep our businesses running, stay home if you're sick, wash your hands, wear a mask if you're within close distance of each other. And if you are one of those people who is inherently at higher risk for whatever reason, then take the extra precautions, which they should be doing anyways, because you can't trust that everybody is going to follow those best practices, and those are the people that should be working from home and should continue to work from home, really. So I think that's the best thing we can do.
Yeah. So I mentioned earlier my biggest fear was fill in the blank. I didn't want to say it, but I'll say it now. I have my note here. My biggest fear is that we're going to be reactive, and we're going to get into this state of reactivity to create a sense of a safe environment, like putting up shields between guests or in front of whatever, like all these extra things we're doing to make it feel safe. We just want to communicate that it's safe, is in fact doing the opposite and communicating that it's not safe because we need all these things when it sounds like we don't. You're shaking your head, but that's not telling my listeners what you're saying.
Right. So let me make sure I correctly understand what you're saying. So your biggest fear is that we are creating an environment of safety, or we're attempting to create an
image of safety.
But it's actually not safe, or it's actually not necessary.
Combination of what is the one thing that we need to do? Like, what's all this extra stuff that we're doing, spending money on, right? When we already don't have the money because the economy's shit. This extra, all these extra expenditures to create an illusion of safety.
Right. I think so. The number one thing you can do, so I think, if I closed my eyes, right, and woke up tomorrow, and if I could make every single person in the world do this, is stay home if you're sick or if you've been exposed.
Okay.
That right there is all we need to do. You could get rid of everything else.
Gotcha.
I think it's also important to wash your hands, right? Everybody should wash their hands. But if we kept those people who are sick, and not everybody, right? Because we talked about that. That's not, one, it's not feasible for the economy. And two, if I get sick, if I start the quarantine as the person with COVID in my household and we wait 2 weeks, my husband or my son or daughter is going to come out of the quarantine with COVID, to expose people. So that 2 week mentality doesn't really work. But if you are sick, and if you've been exposed, to follow those guidelines and stay home. That's the best thing we can do. And I think you bring in a great point too, is we're creating a culture of safety, but is it really even safe?
I don't know about you, but when I go someplace and I see shields and masks and sanitizer around every corner and around every rock, I'm like, that doesn't make me feel safe. That does the complete opposite. Like it's telling people that it's not safe to go out.
Right. No, I agree. And I think masks, you could also make the argument, do the same thing. Are they creating this like false sense of security, and people think, oh, I'm fine to go out because I've got a mask on, when, COVID is still out there. That's why I tell my patients and I tell people, like, you as an individual have to make a decision. COVID is out there. Every time you leave your house, every time you go to the grocery store, every time you go to a restaurant, when movie theaters go back open and you go to movie theaters and you go to school and you send your kids to camp, you're putting them at risk for contracting COVID. Whether or not they're wearing a mask, whether or not they're washing their hands, whether or not there's shields there, these things might decrease their risk, but the risk is still there. So that's a decision that you have to make as an individual. Are you going to accept that baseline risk and just continue to function as a part of the community, or are you not?
Yeah. Kara, it's been well over an hour now, and I don't want to abuse your time, but time flies. It was really interesting and eye-opening, and I appreciate you having this conversation and letting me push the envelope and put you in an awkward position to answering some of my questions. So
absolutely.
Thank you very much. So before we say goodbye, one last time, how can we connect with you?
Oh, absolutely. So my name's Dr. Kara Farley. My company is called Blue Ocean Health Services. So you can find our website online. It's blueoceanhealthservices.com. Or you can shoot me an email. My email is it's Dr. Farley, Farly, at blueoceanhealthservices.com.
Repeat your email.
It's long.
I was gonna say repeat your email one more time because you did break up during that email.
Okay.
So say it one more time.
Email is Dr. Farley, so Dr. Farley at blueoceanhealthservices.com.
And again, this is episode 731. So you can just go to restaurantunstoppable.com/731. We'll link to all that information. And the only other thing I ask all my guests, who's one person you respect and admire and believe would make a great guest on the show, who's a restaurant owner, but I know that's not your vertical. It's not your area, but I am curious, who do you think I should have on the show to learn more about COVID-19, to, you know, I mean, you've told us so much. I don't know if I need to get another, but like, what's one other perspective or angle I'm not considering, or maybe somebody who thinks opposite of what we're saying, who can share a different perspective or different. Does anybody come to mind?
As far as another physician, you know, I don't really have anyone there. I think it might be interesting for you to have a restaurant owner who's experienced a COVID outbreak in their restaurant and what that's felt like for them.
Is there one person in particular that you think can speak extra well to it, who handled it well?
No, unfortunately.
Confidentiality.
Sorry. Yeah.
I understand. Well, thank you so much, Kara, for taking the time to come to the show to share your knowledge and the best practices. There is no questioning, my friend. You are unstoppable.
Thanks, Eric.
Thank you. Thank you for watching. And if you enjoyed today's video, please like, share, subscribe, and hit that bell icon. And don't forget, there is a complete archive of every episode at restaurantunstoppable.com. Peace.